Assalamualaikum warahmatullahi ta'ala wabarakatuhu. I am by Hasmin M. Ragyab, one of the member of group 11, which is our topic is IPT. As you can see in the screen, the IPT therapies is, on the other hand, it does not want to reinforce the passivity and dependency that are characteristics of depression. So therapies who solves all problems may reinforce the patient's sense of inadequacy. The IPT therapist needs to be supportive, enthusiastic, and optimistic to instill hope that the depression will improve and change will be forthcoming, and to inspire the patients to make changes. Moving on, we have the IPT patients. The IPT patients on research has demonstrated that a wide range of patients with major depression are good candidates for the IPT. So the IPT has been validated with minor modifications as a treatment for adolescents, adult, peripartum, and geriatric depression. So if a patient with a comorbid, moderate, or severe personality disorder may be less likely to respond to short-term psychotherapy. So according to the recent adaptation, the IPT for borderline person disorder allows up to 32 weeks of treatments. Next one is the 4 interpersonal problem areas. So we have 4, which is the grief, role disputes, role transition, and interpersonal deficits. So these problems are addresses a patient's complicated bereavement following the death of a significant other. So the therapist facilitates the mourning process, encouraging catharsis, and ultimately helps the patient to form new relationship and find new activities to compensate for the loss. The release of negative effects or effects in the therapy office can help to diminish the intensity of such feelings. The therapist also explores positive feelings the patients had for the person she lost and empathizes with the loss. Finally, the therapist helps the patients explore options for forming new relationships and finding new activities to help to substitute for the lost relationship and give the patient a new sense of direction. So the loss may provide opportunities to meet people and engage in activities the patients might not otherwise have encountered. Role disputes. So the therapist validates the patient's feelings in the relationship, recognizing anger as a natural response to someone bothering her, for example. So the next questions is how to express such feelings. The therapist helps the patients to conceive ways to communicate thoughts and feelings more effectively and role plays potential interactions with her. If after exploring and attempting to implement options to receive the disputes, the conflict has reached an impasse. So the therapist helps the patients to consider ways either to live with the impasse or end the relationship. The third is the role transition. So a role transition is a change in life status, such as the beginning or ending a relationship, starting or losing a job, a geographic move, graduation or retirement, becoming a parent or receiving a diagnosis of a medical illness. For example, getting married many involve having to spend time with the spouse's family. Moving to a new, larger house in a better neighborhood may disrupt relationships with friends in the old neighborhoods. So, if a new role is undesired, a patient may discover unseen benefits in therapy. A patient who has lost a job may come to see the loss as an opportunity to pursue a better job. Lastly, we have the interpersonal deficits. The interpersonal deficits, the least developed of the four problem areas. So it focus the IPT for major depressions only when a patient reports no recent life events and therefore lacks any of the first three problems areas. So the patients in this category tends to be socially isolated and to have few social supports and a history of difficulty forming and sustaining relationship or finding relationship unfulfillingly. Unlike unlike treatment for um, other problem areas, treatment for interpersonal deficits may focus on the relationship with the therapist in the absence of the other relationships and with the understanding the patients is likely to feel uncomfortable in the therapeutic situationship with the therapist serve as a model serves as a model for the patient to form other relationships. So, given that the IPT usually focuses on a life event, um, it have been shown to respond least well to IPT. It is important that to identify the patients who have underlying dissentment disorder or dissentment disorder because such patients often describe few recent life events. So there is an IPT protocol adapted to the treatment of patients who are dystemic dyssyntemic rather.